Technical Veterinary Learning Channel, honored by Professor Ahmed Mamdouh Sharif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University, Egypt, presents today series of epidemiology to be completed. Today, we are in the third episode of Principles of Prevention and Control of Infectious Diseases. We will discuss and clarify completely the following: notification, notifiable diseases, survey, environmental monitoring, registers, preparedness of diseases and the crisis, definition of determining of epidemiological status and their benefit, action plan of disease control and eradication, and we will finish by infection prevention and control, or EPIC. Notification: it is the reporting of certain veterinary diseases or human diseases or other health-related conditions by a specific groups as specified by law, regulations, or agreement. In case of human or veterinary medicine, notifications are typically made to the state or local health and or veterinary agency. Notifications are often used for surveillance, and they aid in the timely control of a specific health problem, veterinary problems, or hazardous conditions. When notification reports are required by the law, the diseases or conditions to be reported are known as notifiable diseases or notifiable conditions. A notifiable disease: it is one for which regular, frequent, and timely information regarding individual cases is considered necessary for preventing and controlling the disease. This is what's said by WHO organization. Examples of notifiable veterinary diseases: OIE headquarters since 2013 established a single OIE list of notifiable terrestrial and aquatic animal diseases to replace the former List A and List B, such as lumpy skin disease in cattle, foot and mouth disease in cattle, BBR in sheep, and etc. Examples of notifiable diseases in human: WHO organization list for notification includes polio, cholera, yellow fever, plague, and smallpox, etc. and etc. Survey is an investigation that uses a structured and systemic gathering of information from a sample of a population of interest, either human or animal, to describe the population in quantitative terms. The majority of surveys gather information from a representative sample of a population so that results of survey can be generalized to entire that population. The subjects of A survey can be members of general public, patients, health care providers, veterinary health diseases, or different types of organizations. Although topics of surveys might vary widely, surveys are typically designed to obtain specific information about a population and can be conducted once or on a periodics time or times. Environmental monitoring. Multiple qualitative and quantitative approaches are used to monitor the environment depending on the problem setting and the planned use of the monitoring data. Estimating disease attributable to a specific environmental risk. Once studies, as described above, have shown that a particular disease is an important public health or veterinary problem in the community, the next step is to identify the important environmental risk factors that are driving the occurrence of that disease. There are three approaches to estimating the contribution of risk factors. Number one, some form of quantitative risk assessment. Number two, one or more epidemiological investigations. Number three, the use of pre-existing global estimates. Furthermore, the data sources referred to above can be used to estimate the disease burden attributable to study environment, poor water and sanitation. Dusty environment. Today is the 9th of May 2021. The dusty environment elaborated suddenly at 5:00 p.m. in Egypt today may help in increase the asthma as a human health problem. In veterinary health problems, the following diseases may increase during the following days, such as foot and mouth disease, which carried by the air for about 100 to 150 kilometers. Babesiosis and theileriosis will appear in new areas due to carrying of infected ticks or infected mosquitoes from endemic areas by babesiosis or theileriosis to free areas by air for about 100 or 200 kilometers. So, dusty environment has a bad risk factor on veterinary or human health. So it acts as a very important, noticeable risk factor in occurrence of diseases. Dragon's storm turns deadly post-flooding rain, strong wind swept through Egypt during March 2020. Flooding rain transfer the soil from areas to another's. So some diseases may be transferred to a new areas, such as anthrax, cholestridiosis, leptospirosis, and so on. Registers. Certain registers are required by law, such as registers of vital events and or outbreaks of diseases. Registers maintaining is a method for documenting or tracking events or populations all over the time. Registration example: birth and health certificates are permanent legal records that also contain important health and or veterinary related information such as lambskin disease, foot and mouth disease, glanders, etc. A disease registry, such as a malignant catarrh fever disease, tracks an animal with that disease over time and usually includes diagnostic, procedures, treatments, and outcome information about the disease in certain populations during certain time in a certain areas. Although the majority of disease registers required facilities to report information on patient and all animal with disease, an active component might exist in which registry periodically updates information throughout review of health, vital, or other records, such as vaccination programs. Preparedness. Preparedness refers to research-based set of actions that are taken as precautionary measures in the face of potential disasters. These actions generally can include both physical preparedness, such as emergency supplies depots or adapting buildings to survive during earthquakes, and training for emergency action during disasters. Preparedness is an important quality in achieving goals and in avoiding and mitigating negative outcomes. Disaster preparedness, defined by the United Nations as involving forecasting pandemics and taking precautionary measures before an imminent threat when warnings are possible. Methods of preparation include research, estimation, planning, resourcing, education, practicing, and rehearsing measures. Emergency preparedness includes early warning of disease system and early reaction to any disease outbreaks occurrence. What we have of benefits: add a health providers for human or veterinary providers for animals from determining epidemiological status of infectious diseases. These benefits are: number one, development of an effective early warning system about the different health problems or veterinarian problems. Number two, emergency preparedness for enhancement chances of eradication and or control of different diseases. Number three, locating the strategy of disease control all over a zone, area, farm, and or the whole country. Number four, placement the strategy of vaccination programs of different diseases. Number five, determine factors for leverage of control points. Number six, set the occurrence of exotic or emerging diseases. Number seven, develop a zoning approach for declaring a free zones from diseases. These steps of action plan for disease control and eradication. Number one, find the disease surveillance. Find the disease in order to eliminate it before it has had a chance to spread. Number 2, contain the disease, prevention of spread. Number 3, eradicate the disease by mean elimination of the disease. These steps will take time, consume efforts, and needs resources. Implementation of any control program for certain disease should take into consideration the following items. Number 1, species affected, by means that taking in consideration the host range. Number 2, zoonotic potential, to know that is this disease transmitted to humans or not. Number 3, potential spreading threats. Number 4, modes of transmission. Number 5, survival in the host. Number 6, survival in the environment. Number 7, reservoirs. Number 8, economic capacity. Infection Prevention and Control, IPC. It is a scientific approach and a practical solution designed to prevent harmless caused by infection to animals and or human patients, veterinarians, as well as health provider workers. IPC, grounded in infectious diseases, epidemiology, social science, health and veterinary system strengthening. IPC occupies a unique position in the field of patient and veterinary safety, quality universal health coverage, since it is relevant for veterinarians, health workers, and patients at every single veterinary and or health care encounter. Series of principles of prevention and control of infectious diseases to be continued.